Good morning, everyone. This is Taylor Gardner with Western Marketing. I'm a health marketer here. Today, we're going to be going over the health access plan with Allstate, and then we're also going to kind of touch on some of the ancillary products that go with it. With that, I think that about kind of covers the intro there. So I'm going to let Caden go ahead and take over and let him just kind of walk you guys through the product and basically why it's so important. Hayden, go ahead.
Perfect. Thanks for the intro there, Taylor, and thanks everyone for joining. A real quick up on my screen, you'll see this Elevate Rewards program. If you haven't already registered your account, get that done. It's just free money back in your pocket as you sell policies, you earn points, you can redeem those for a lot of different good stuff there. But let's get into why you guys really joined today, and that is Allstate fixed benefit as well as ancillary plans that can go along with that. Short-term medical is now back, but there's a few states where the pricing is a little harder on short-term medical, or a few states where we're not able to have long-term solutions in short-term medical, where fixed benefit policies fill in a really nice gap, especially in states like Illinois, Nevada, South Dakota, Colorado, Michigan, those ones that don't have a long-term short-term medical solution. Fixed benefit can really fill in this gap, especially with all the ACA changes. So super excited to be on today. I appreciate the partnership of Western Marketing as well. I know you guys have phenomenal support over there. My favorite agency to work with personally. So you guys are in good hands. No pun over there, but Western Marketing's got you guys taken care of. But if there is anything you need on the Allstate side, feel free to reach out to me and my team as well. If we haven't chatted before, my name's Caden. I'm up there in the top left. I'm the field VP for this territory and happy to help you guys out with really anything you need. I happen to be on the road a decent amount, so sometimes I'm a little harder to get a hold of. If I am harder to get a hold of, you can definitely reach out to Sherry, who's the regional sales manager here. And she knows the products better than I do, to be honest. So she'd be a great resource for you. So feel free to give her a call, shoot us an email, or you can even scan that QR code next to her name and book a one-on-one training session if you want to do a deep dive or talk about a specific client or anything like that. And then if you ever need any back end support, Lynn's a great resource for you as well. So open enrollment is over, and a lot of agents in January, well, January they're sleeping to recover after such a busy time. But then February rolls around, March rolls around, and you start looking like the thinking man a little bit, wondering what are you gonna do now? It was so busy. This time of year is so much different. There's been a lot of ACA market movement to make the entire landscape of things really different now. And the solution for year-round success, because all the best agents, they're selling year-round, and all the best agents, they're cross-selling. The solution is marketplace alternatives, whether that's short-term medical, whether that is fixed benefit policies like we're going to talk about today. The solution is marketplace alternatives. You can sell them year-round. There's no open enrollment dates. They're significantly cheaper than marketplace plans, and you earn a lot more commission selling these as well. So it puts you in a really good spot. And then cross selling, there's a few reasons why cross selling is even more important now. But a few of them are on the screen here. So, like I was saying, ACA Marketplace went through significant change this year. For starters, the subsidy cliff came back at the 400% of income level or poverty level. So if you make more than 60 grand as an individual, about more than 80,000 as a couple, 125,000 family for, you get the point. If you make more money than that, you get $0 of subsidy in the ACA marketplace, meaning your price just maybe doubled, maybe tripled, who knows? Just to kind of depending on where you were at. Not only this, not only losing subsidies, but the marketplace took on average a rate increase of about 23%. This was sometimes a little lower, sometimes a little higher, depending on what state you were in. But needless to say, that was significant price disruption for your clients, especially combined with losing those subsidies. And then, of course, individual max out of pockets. broke $10,000 to make it a little bit worse on you as well. So safe to say you felt a little bit like this preparing for 2025, in 2025, and now in 2026 still. You just kind of have to smile through the chaos. But there is reason as well to smile. I know you guys are taking more hard phone calls than you ever have in the past. But the good news is there is significant opportunity with this as well. Significant opportunity for you guys to save your clients money by getting them on one of these alternative plans and saving that relationship and keeping their price somewhere where they can afford it. And also significant opportunity for you guys to earn significantly more commissions. Um, Health Access typically pays about uh, 3-4 times as much commission as you would earn selling a marketplace plan. So you're going to make a lot more money. You're going to save your clients a lot more money as well. So who's the customer and when does it make sense? For starters, like I mentioned, there's no open enrollment period. So it's year-round enrollment. So first, if starters, if a customer is outside of that open enrollment period and you're enrolling them in February, March, throughout this entire year, you can sell them on these plans as soon as next day, effective date. So today is February 24th. We could sign someone up on a February 25th plan. There's no enrollment periods. Next day effective dates, and that's year-round enrollments. Makes it really easy for those customers caught outside of an open enrollment period or not qualifying for a special enrollment. The main customer block or qualifier here as well is they don't want to pay high ACA costs. They need budget-friendly options. They're those middle income earners who don't get subsidies because they made more money than that graphic I showed you on the previous slide. But they're not making millions and millions of dollars a year to the point where $3,000 a month for a marketplace plan doesn't matter, right? They're still price conscious middle income earners essentially is who you're kind of looking for. Also, people between jobs just trying to bridge a gap. You can fill in the gap with one of these plans real quick, or early retirees turning 65 clients. Maybe their spouse just went on to Medicare and the other spouse is 63 and this has a few years. This plan would work great as a solution. How it benefits you as the agent, we talked about this a little bit, but when the price of the plan you're selling costs half as much, you're selling a $500 plan instead of a $1,000 marketplace plan, you have a lot more dollars left over to essentially go towards ancillary solutions where you can cross sell. And again, you better protect your client by doing that. And you also are earning more commissions. The Health Access, short-term medical alternatives, they pay way, way better commission than an ACA plan does. Instead of $20 per member per month, you're looking at usually 3 to 4 times as much as that. It also gives your clients an affordable insurance solution, helps your retention, helps your reputation, and just gives you a solution that way when clients are getting priced out of the marketplace. As far as underwriting goes, so the ACA marketplace is essentially financially underwritten. It's just based on how much money you make is how much money you pay. With Health Access, it is medically underwritten. So we are going to ask you a few health questions. And then pre-existing conditions are not covered, as well as maternity. So there's a few stipulations there. If you're planning on getting pregnant, don't get on this plan. If you have significant amounts of health conditions that are already existing, don't hop on this plan and expect all that to be covered. But if you are a healthy individual, perfect. If you are a higher income individual or middle income individual not getting those subsidies, perfect plan. Again, available year round. Another big perk is children only policies. So a lot of the times your clients or maybe potential clients will be on a group plan for their health insurance. So their employer pays for their health insurance on a group plan. Maybe the client can add their kids onto that plan, but oftentimes the employer doesn't pay any of the premium to do so. So the client's left paying significant amounts of money to get their kids on their group plan with them. Instead, you could do a child only, so the parents don't have to be on the Health Access plan. So that makes a lot of sense when, the parents want to stay on their group plan because the employer pays for the workers, but they need something cheaper for their kids. There's also no social security numbers required on these plans as well. So a nice part is if you run into, non-citizen, asylum seekers, anyone without a social security number can get this plan. We just need name, date of birth, address, and you're good to go. If you haven't seen this yet as well, this is a really unique tool to our quoting platform. And what it does is it gives you the capability of quoting a marketplace plan side by side with a short-term medical or a health access plan. So you can do this by creating a proposal and then you add a proposal next to it. We have a Sherpa integration that allows us to see those marketplace plans, is how we're doing everything this way. So on the left-hand side, you'll see a marketplace package, essentially. We've got a Blue Cross Blue Shield of Arizona plan, high deductible, $1,500 a month. And then we've paired that with a cancer, heart attack, stroke, and a plan enhancer accident plan to help fill in some of those gaps. On the right-hand side, you will see a significantly more affordable package here. And this is our health access package. So I just wanted to give you the visual of how much cheaper and more affordable these plans are. So the core plan essentially is going to be this health access $530 a month combined with specified care, which is essentially your stop loss. We'll talk about how that works in a minute. But needless to say, the fixed benefit setup with some accident, cancer, heart attack, and stroke got cut off, but it's down there as well, is about half the cost. So in this situation of age 40 parents, age 7 and 4 dependents, family of 4, no subsidy, that's about $800 a month cheaper, which is almost $10,000 per year. You would be saving this family of 4. I don't know about you, but I'm not aware of too many other situations where you can save someone $10,000 a year. In my opinion, you'd be a hero for this family as long as they're healthy and it makes sense. You're saving a family of 4 $10,000. That goes a long ways, especially when you are in that child rearing stage of life, right? So again, much more affordable, and the crazy part is you're making three times roughly as much commission selling this cheaper plan as you would make selling this plan on the left. Couple additional highlights, and then we'll dive into the nitty gritty, how this plan works, what the schedule of benefits looks like. But did want to mention it's simplified issue, so there is underwriting, but it's essentially an instantaneous decision. You don't have to sit around waiting for 2 or 3 days to figure out if it'll be accepted or not. The Recuro RX is something you can attach onto these plans, which gives you a $0 copay on prescriptions, which is a handy benefit. We've also got unlimited telemedicine perk with that Recuro you can add on for $0 visits, unlimited 24/7 year round. Nationwide PPO discount or network as well to get you a network discounts. Now, the way these plans work in the form of fixed benefit, you get the same benefits no matter what. But when you combine that with in-network discounts, it's a very, very powerful benefit combination. There's also a 3-year price guarantee baked into these plans as well to give you long-term plan stability. You don't have to worry about price disruption. As I mentioned earlier, those marketplace plans, they just took 23%. Needless to say, that $1,500 package option could go up another 20% next year, and we're at $1,800, and then another 20%, and we're at $2,100. You never know what's going to happen when you don't have a price guarantee. So that $750 package you saw on the right, that health access package, that's going to stay at that $750 number for at least 3 years, is guaranteed, but oftentimes we just don't touch the rates and we let them ride forever. These plans are going to give you preventative and unplanned coverage, and the big perk of going fixed benefit instead of more of a traditional style insurance is we pay first. There's day one benefits. Allstate's going to take the brunt load up front so your client doesn't have to. So again, the way these plans work, set dollar amounts, and we'll dive into what those set dollar amounts look like in a second here. We've got a couple different options as far as coverage goes. You get benefits day one, so you don't have to sit around waiting to use these. The only waiting period is on preventative care, and it's 90 days. So just make sure you wait 90 days before you do your annual health exam or preventative visit. No lifetime limits. You can't run out of coverage in that way. And then with the First Health Network, it is very broad. You can pick any doctor or hospital. Again, you're getting the same fixed benefit, whether you're in or out of network. But you stay in that First Health Network, you're going to get in or discounts. So here's a map of availability. Essentially, anywhere in light blue or dark blue, we have one of these fixed benefit solutions, one of these health access plans. Light blue and dark blue are slightly different, but nothing you have to worry about. In the purple states, we have a somewhat different solution there. But states I really want you to look at where this health access makes sense right now is Illinois, Nevada, South Dakota, Colorado, and Michigan. Those states don't have a long-term, short-term medical solution, or they have no short-term medical whatsoever. So those make a ton of sense to get your clients on these, and all those ones I just listed have the health access plan. A couple others you can look at: Arizona, Texas, Florida. Some of those states where people want day one benefits, short-term medical maybe isn't available, or maybe it's just not as affordable. These health access plans can make a lot of sense in those states as well. So a couple additional highlights, benefits day one. Again, you can go to any doctor. There's no deductibles or co-pays, which is a huge benefit that your insurance pays first instead of client paying first. You have both preventative and unplanned office visits covered as well. So I'm a visual learner personally, so I hope this cheesy little graphic helps you guys wrap your head around kind of the difference, because with fixed benefit plans, we're essentially flipping on its head how insurance works. So this is a visual of a short-term medical or marketplace, ACA plan, group plan, more of those traditional style plans. And what happens is when client gets the bill in the mail, they pay first. Your client pays first. That's essentially your deductible, your co-insurance, your co-pays. Now max out of pocket's over 10 grand on an ACA plan, but these deductibles and max out of pockets keep creeping up. And with a client pays first solution, that oftentimes means your client is paying the entire bill, if not most of the bill, right? And then insurance comes in after the client's requirement has been satisfied, and they essentially pay the rest and finish off the bill. Now, with health access, these fixed benefit plans were, again, essentially flipping it. So instead of your client paying first, Allstate's going to pay first. We're going to pay first for them. So we're going to take these fixed benefit amounts, pay them towards the bills, and then if there's any amount of money left over on that bill after the fixed benefits have been paid, we can finish that off and client can pay the rest to complete that bill. So again, with a traditional style, it's a client pays first solution, insurance pays second. With a fixed benefit health access plan, it's an insurance pays first solution, client pays second. What these fixed benefits look like is up on the screen now. So again, these are ACA alternatives. So you're selling these instead of a marketplace plan. Quorum Plus are the two you're going to want to look at here. One of the very strong benefits in here you'll see is the outpatient surgery. So for example, a colonoscopy would fall under outpatient surgery. If your client schedules a colonoscopy, goes in, they're going to get a $4,000 benefit on the core plan. And then they're also probably getting a outpatient anesthesia down here of $750. And then you're also probably getting a $500 outpatient surgical facilities, depending on how it's all set up. But that would give you $5,250 of benefits. And I don't know how familiar you are in the colonoscopy world, but colonoscopies definitely don't cost $5,000. The nice part about a situation like that, where the benefit is bigger than the bill, is those extra dollars actually go back in your client's pocket. So if that colonoscopy costs $3,000 and the benefits are $5,000, we take care of the entire bill and put $2,000 back in your client's pocket. Now, let's say it's the reverse and it's a $5,000 benefit but the bill is for $6,000. Again, these fixed benefits would take out the $5,000, and then your client would pay that remaining $1,000 would be their portion, whatever's left over. So it goes both ways. Hospital admission really strong here, $2,000 right off the bat, and then every day you are there due to sickness, you're getting $3,000 per day. Every day that you're there due to injury, you're getting a benefit as well, and those stack up. They're not capped on an amount of days or anything. More surgery benefits for inpatient, outpatient. You're also getting doctor office visits covered as well here. So regular visit, 150, preventative visit, 150, urgent care, 150. And you can go to the plus and get those up even more. Radiology, labs, even chemotherapy is on here as well. Ambulance coverage is very strong on these plans. You get $1,000 on the ground, $25,000 on the air. A lot of competitors out there. I don't want to mention names, but their air ambulance only covers $1,000, which definitely does not cover the the price of a helicopter ride to the hospital. So having that for emergencies definitely helps. And if you have any questions on kind of how these stack up together or want to deep dive on these, please let me know. We can chat about it. Again, we're going to use the First Health Network here. It's a nationwide PPO. 96% of the US population has access within 20 miles. You don't have to use the network. You're going to get these same fixed benefits either way. But the benefit is if you stay in network, you usually save 30 to 50% off the bill in the form of in-network discounts, and then those fixed benefits go a lot further once that bill has been discounted. Talked about Recuro a little bit, but essentially it's giving you two big benefits: $0 copay on most generic prescriptions, and then unlimited, no cost telemedicine visits 24/7. Easy to use member portal here. It's $10 a month for unlimited family members, whether you're one person or 10 people getting on the plan. It's just that $10 flat. And then you can also add virtual therapy for $5 a month extra. With Recuro, after your clients sign up, they're going to get a welcome email. Just make sure they look out for that so they can register for the portal. The only way to access the $0 copay on prescriptions and the telemedicine visits is registering and getting in that portal. If you have any questions on this too, let me know and I can help you get ahead of it. So let's look at an example now of how this health access plan works in the real world. So Michael walking his dog, fell, tears his rotator cuff, and now needs surgery. Expensive surgery too. It's $19,500. Good news is Michael stays in the First Health Network and gets a very nice, generous discount of $10,000 here. So he's left with essentially about $9,000. The surgery benefit for that rotator cuff through the health access plan happened to be $4,000. Must have been that outpatient benefit we talked about earlier. Also had an assistant surgeon, so he gets another $1,500. Anesthesia, another $500, and then an ambulatory surgical benefit of $500. So these four benefits stack up together, pay out most of that remaining bill after the in-network discount was applied. And so Michael was only left from a $19,500 surgery. He's only left with a $2,800, $2,860 bill, which is significantly lower than 90% of the plans out there would leave him on exposure wise on a $19,000 surgery. So very, very strong benefit there. Now, what I want to talk about, and maybe something you've thought about during this presentation, is that's great, $19,000 surgery, awesome. Preventative care, awesome. Maybe colonoscopy, these smaller tier things. But what happens when a true catastrophe hits, a cancer, heart attack, something that's going to cost a significant amount of money? Well, I'll tell you right now, I don't want your client to be in a situation where we pay first and it only covers half of a $200,000 bill, and then the client has to pay the rest and they're caught up with another $100,000 out of pocket themselves. This is not the situation I want to put your client in. The good news is we have plans you can pair with these to put on the back end, and when you do so, now Allstate doesn't just pay first, but we also pay last. Your client might have to bridge the gap in the middle there just a little bit and pay a portion themselves. But essentially, we're putting a large deductible catastrophe plan on the back end. That way, if a true catastrophe hits, they have this stop loss coverage. Again, Allstate's paying first and last. The best form to do this is called specified care. So the specified care plan, again, large catastrophic deductible, 30,000 to 100,000. And then you get 250,000 per episode, $2 million plan max. The conditions covered are these 18 conditions. So you've got your big ones, your cancer, your heart attack, stroke, paralysis, severe burns, major organ transplant. It's hard to come up with a scenario that's going to cost your client a significant amount of money that's not on this list. So this is essentially your catastrophe insurance. You've got your fixed benefits up front. 99.9% of your clients are going to be just fine with just the fixed benefits, but you want to sell this plan as well to all your clients, because that 1% of your clients who does have a catastrophe, it's going to be crucial that they have that back end coverage to help with those bills on the back end. So let's look at a catastrophic example. Mike needing heart surgery now. First tears his rotator cuff. Now poor guy needs heart surgery. Has not been a good year for Mike. So through that core plan, stays again in that First Health network, gets a 35% discount, and knocks 43 grand right off the bat. So he's left with about an $80,000 bill. What happens is he gets surgery benefits, he gets hospital admission benefits, hospital stay benefits, doctor visits while he's in the hospital, anesthesia. He gets a lot of different benefits, needless to say. Those all stack up together, and the access plan, the fixed benefit plan, pays about $27,000 out. Now he is on the $30,000 deductible specified care plan. So he only has to pay $2,500 out of his own pocket to just kind of bridge the gap from what that health access plan paid out to meet his $30,000 catastrophic deductible. Once that's been met, after he pays his $2,500, specified care deductible's been met, and specified care pays the rest of the bill and knocks out the remaining $50,000. So again, most of your clients will never utilize the specified care plan, but it is crucial you sell it to everyone, because if he did not have the specified care plan, he only had the health access plan. Well, now he's facing a $50,000 bill instead of a $2,000 bill. These are the states where specified care is available. So most states where health access is available, you're going to be just fine selling the specified care as well. Where specified care is not available, so a few of the states you mentioned, Colorado, Texas, where that's not available, we've got some other solutions that make a lot of sense. Our term life with critical illness plan, especially this one, pays out up to $150,000 in a lump sum. It covers that exact same list of critical illness conditions. The difference is, instead of hitting a deductible first, then having everything covered after that, you're just getting a lump sum. So if you get, for example, on that heart surgery, if you are on this term life critical illness plan on the $150,000 benefit, Mike would have got a $150,000 lump sum paid out to him, knock out that $50,000 remaining bill, and have 100 grand left over to have a little party, go on vacation, whatever he wants to do with it. There's no deductibles, copays. Again, same list of critical illness conditions. This is going to pay out a lump sum in the event of diagnosis of one of those critical illnesses to kind of help with that catastrophe and cover you on the back end. So I do want to mention a couple more supplemental plans now. But if you have any questions on those ancillary plans, let's just save it for the end, and then we can go over questions. So let's dive in here to supplemental, because by all means, the health access plan does a really good job as a core health plan, but there's always room for improvement to fill in the gaps a little more, add benefits that aren't included in a core health plan, like maybe a dental insurance or life insurance. So there's always gaps, and this goes for not just the fixed benefit plans, but you can combine these with short-term medical. You can sell these to people on group plans. You can sell these to people on an ACA marketplace plan. There's always gaps, and there's always opportunities where you can help your client and you can make more money doing it. So again, visual learner, I'm sorry for all the cheesy examples, but had to throw this one up just because it makes too much sense not to. So this is essentially the situation your client is in when they're on a standalone health insurance plan. It's a one-legged stool, they're wobbling around everywhere. If they are an elite athlete, maybe they can have balance for a minute. By the second they lose their balance, their wallet essentially has to support them, right? Without those additional legs on the stool. This keep creeping up and up and up. Again, 2026 broke $10,000 for a max out of pocket on marketplace coverage. But deductibles, co-insurance leaves your client with a significant amount of exposure. And most clients, if you ask them, can you pen that check? They probably say no. They don't have $10,000 lying around to help support themselves. Your client's already facing the emotional impact of a catastrophic claim when these health events happen. So the best situation for them is that you as the agent can help eliminate that financial impact so it's not weighing on their heart during that emotional time. The best way you can do that, add some additional legs underneath that stool in the form of supplemental insurance. Again, maybe these are benefits that the core health plan just doesn't cover. Maybe these are benefits that could just fill in a gap of out of pocket exposure. But either way, they always make a lot of sense. You can sell these standalone, you can sell these bundled with other plans. They go with everything. The nice part is that we find when these plans are sold, acquisition costs improve, retention increases, and more referrals are generated as well. The reason, at least I like to think the reason would be, is you're creating a win-win situation for you and your clients. When your client now breaks their arm, instead of saying, hey, you've got a $5,000 deductible you got to pay first, you can say, hey, I signed you up for an accident plan. Don't worry about it financially. That plan's going to take care of the entire cost. You're going to pay zero out of pocket for your surgery for your broken arm. That is a very happy client despite walking around with a broken arm, right? They're going to tell their family about you. They're going to stick with you for life because you properly insured them. So first plan I want to talk about is our plan enhancer accident plan. This is guaranteed issue. So as long as your client can breathe and has a credit card, they are good to get this plan. But it's a accident plan at its core, with benefit levels ranging anywhere from $2,500 to $17,500. The idea here is typically you want to match that max benefit with whatever their out-of-pocket exposure or deductible is. So if they're at a $10,000 deductible, short term, given a $10,000 plan. Maybe they're on the health access plan and they just want a little bit extra help in case of accidents. They got some crazy young kids jumping off of stuff. Give them a $5,000 accident plan just so they have that extra protection in case they need it on the back end. The nice part about these plans as well in most states is you have two optional riders. So you can sell cancer, heart attack, and stroke plan with these. That matches the benefit level, again, pays a lump sum out. And then you also have a sickness hospitalization rider as well. You can sell with it. If they're admitted to the hospital due to sickness, they get that same lump sum again, paid out immediately. This is now available as well for seniors up to age 75. So not just an under 65 product anymore. And the pricing is really, really strong as well for all ages, pretty much nationwide. So again, really easy way to add a powerful benefit with this plan enhancer. We also have a standalone cancer, heart attack, and stroke plan. The 25K and 30K levels are guaranteed issue, so you don't have to go through any underwriting for those. It does pay first ever diagnosis, however, though, so it's not guaranteed coverage, it's guaranteed issue. If you've already had cancer in the past, you're not eligible to get a payout there for the cancer portion. And same thing goes with heart attacks and stroke. No network restrictions, you can go anywhere you want. Dependent coverage is available, which is pretty cool. But yeah, really, really solid plans here. Everyone unfortunately knows someone who's been diagnosed with cancer or had a heart attack. These are scary situations and they are expensive ones as well. So best thing you can do for your client is, again, help them avoid that financial catastrophe while they're dealing with that emotional impact of the catastrophic health event. As far as dental goes, we have this very, very unique situation. So if you've never sold copay to dental, I want you to turn up your volume on your computers right now. Listen up. This is a really, really sweet plan. It's the best dental plan in the industry. And those words didn't come out of my mouth first. I heard that from a lot of different agents before I started to even believe it, because it sounds very biased coming out of my mouth working at Allstate. But this copay 2 plan is very special. The reason being most dental plans have a annual maximum. That's usually $2,000, $3,000. Then you run out of coverage. Uh, those plans that have a bigger max out or annual maximum that goes up to maybe 3 or 4,000 typically have waiting periods. Significant ones, 6 months, 9 months, maybe 12 months, or the benefits are just really low and slim year one, which is essentially a waiting period built out in a different way. This copay plan too has no annual maximum. You can't run out of coverage. But not only that, it has no waiting periods. You can use this day one. You can essentially sign your client up for an effective date of tomorrow, and then you could go get a root canal tomorrow and just pay this $500 copay. Wisdom tooth extraction, major service tier 125 bucks a piece. Filling, $100, get that cavity taken care of. Preventative care, $0 copay. We're taking care of that for you. Copays get even better in year two as well. So this is a very, very strong plan, and most states price pretty well as well. Most premium dental plans I've seen out there from other carriers run 70 bucks a month. This plan's typically about 50 bucks a month. Does have a bundle requirement, as you're seeing up front. So that's the too good to be true things. You have to add a $5 accident plan on it with it, or you're unable to sell the plan standalone. But again, you can have a $5, $10 accident plan added on, no problem, and that will satisfy that bundle requirement. For people who are maybe lower utilization, they don't need those root canals day one type situation. We've got the value plan, which is our more economical plan, plus plan as well. And then prime plan is our only plan with orthodontia care. So if you've got essentially kids who are 18 or younger needing braces, I would put them on the prime plan. If you don't need braces or you're lower utilization, I would go with that plus, and then higher utilization, need those benefits day one, copay plan 2 all day. These plans as well, these other dental plans they don't have a bundle requirement, but they do get a bundle discount if you bundle them of 15%. So even though there's not a bundle requirement, I would definitely recommend bundling them anyway. This prime plan again is our only plan with the orthodontic care. We have our incentive trip coming up about this time next year. You have through the end of 2026 to qualify to go on this plan. I would love to see a couple agents from Western Marketing qualify to come on this trip. It's a 5-star, all inclusive. You get to bring a plus one. It is an exceptional, exceptional trip, and we would love to have a few of you there. I would say as a benchmark or something to shoot for is if you can sell about 500,000 premium with us this year, you're going to have a good shot at qualifying. It's the top 50 agents in the country who get to qualify here. So this puts you not only on an awesome trip, but also an opportunity to network with some really special individuals, build some ideas, network, learn more about the business, how you can do even better things. Couple highlights as well. So we went over the ACA alternative health access. You combine that with specified care, critical illness, your client's in a really good spot. Doing so, you're usually about half the premium of a marketplace plan, and you make 3 times as much commission. Day one robust benefits. It's a plan that pays first. We've got that comparison tool that's going to be really unique to give your clients and yourselves that visual and really process the premium savings and the coverage differences. No deductible, these plans pay first. That's the big difference, is instead of in client pays first solution, it's an insurance pays first solution. Recuro helps with the $0 copay on prescriptions, unlimited telemedicine. And then we've got those guaranteed issue accident and critical illness plans that go with everything, fixed benefit and beyond. No socials are required. We can do children only policies. We are a very dynamic carrier, and we like to help our agents as well. So if anything sets us apart more than what we've already talked about, it's the white glove red carpet service you're going to get Lack of support and training is not something you're going to have over here at Allstate. So if you need to get on the phone with someone fast, if you need quick support, if your clients need quick support as well, our member services is all based in the United States, out of Milwaukee. Great gals up there who are going to help your clients. You're not going to have your clients wait on hold for 40 minutes to talk to someone in a foreign country. And as well, we speak agent. I started as an agent. I've been in your shoes. You guys have the hardest job in the industry, and I know that because I've been there. It's the most stressful. It's the hardest thinking. It's the hardest working job out there. So anything I can do now that I'm on this side to help you guys succeed, take a little bit off your plate and help you out, please let me know. Happy to do so. I'm going to jump into a live quoting demo here. But while I get that set up, going to throw out my contact info one more time, just so you have that as well. If you want to reach out to myself, Sherry or Lynn in the future. All right, let's get this quoting demo. So if you haven't ran a quote with us in the past, this is essentially what it looks like when you first log in. To start a quote, all you need to do is plug in zip code, which I already did for Scottsdale address, gender, date of birth, so 40-year-old, keep that same rhythm. And then effective date we can do as soon as tomorrow. I'm going to throw in March 1st. And then I'm going to add a spouse and we'll add a kid as well. Once you're in here, you don't have to fill in all the names right now. That's optional. But you will need to plug in the date of births. We'll make the husband same 40 years old. And then we will plug in a 2020 male there for kid. So family of 3, we'll hit quote now. Now we can dive into the plans. So we've got short-term medical. We've got the health on exchange button. This is where you're going to go first if you want to compare the marketplace plans side by side with one of these alternative plans. So let's start there in the health on exchange. Fill out a few pieces of information here on smoking, family of 3, income, because it's going to calculate those subsidies. Say family of 3 making 120,000. Keep that March 1st, and now show plans. And this tool again is just pulling information all over from Health Sherpa, so it's going to be follow suit there. It's going to calculate $0 subsidy. From here you can filter out bronze, expanded bronze if we wanted to see those plans. Scroll down here. Oscar's looking at about 1,000. UHC standard bronze. Let's go with that one, $7,500 deductible. From here, you can package up Ancillary, so you can see what a total package would look like. But to keep things speedy, I'm just going to start building this proposal right off the bat now. So to do that, I'm going to hit email proposal over here. And once I click that, this is where we're going to start this side-by-side comparison. So from here, you can shoot this off to your client. But first, we want to add the health access plan side-by-side. So to do that, I'm going to scroll to the bottom. And then you'll see this add another package button. Now I'm click that, come in here. Health access is going to be under this fixed benefit indemnity tab. Scroll to the bottom. And the plans again we talked about is core and plus. You're going to see this cheaper version, this metal gap. The coverage is built to be a gap filler on a short-term medical or marketplace plan, and then basically shut off and let the core plan do its thing. So don't sell metal gap on its own. Again, that's a gap plan to pair with a short-term medical or marketplace. But core and plus are the ones we talked about today that you're going to sell instead of short-term, instead of marketplace. This core plan, let's add that to the cart. And then we're going to see the specified care and Recuro options pop up. With specified care, you can go with any of these levels. Most clients like to go with the 60,000. That's kind of a perfect blend of price and benefits. And then once that's added to the cart, new total is going to be over here. Now from here, if I wanted to add that plan enhancer we talked about, that's going to be in this accident tab. So let me go over there. Young kids especially, I think it's worth it to add a little accident coverage on. So you can do this $5,000 of accident coverage for the whole family for $25. add that to the cart. If we wanted to add cancer, heart attack, and stroke as well, which I think is a good idea, it's $22. And then if you wanted to add cancer, heart attack, and stroke and sickness, that'd be $65. So let's just add this cancer, heart attack, and stroke and call it a good day there. And then we'll essentially add to proposal. And that's where you're going to generate this side-by-side comparison. Takes a little longer once you get the second one in there. From here, we can edit the package. So we can, marketplace package. We can make this one say access package. If you could add a short-term medical package and have 3 options if you wanted. So you can get pretty funky in here. From there, you can email it to your client. You can screenshot it, send over a screenshot. But I think this visual representation is going to help you tell your story a little better of, hey, I'm going to save you $6,000 a year by going with package 2 instead of this marketplace package. That saves you a lot of money. It also puts you in a situation where instead of having to pay a $7,500 deductible for your healthcare first, you have day 1 benefits in the form of this core plan and then catastrophes still if it does happen. So that's basically it in a nutshell. Gonna put my contact info up here one more time and open it up for questions if there are any. But again, thank you for joining today. Thank you, Taylor at Western Marketing, for setting this up. I appreciate you guys' partnership. Love working with you guys. And if there's anything I can ever do to help out, let me know.
Awesome. Well, thank you so much, Caden. Not seeing any questions. So, yeah, I think one thing to push, if you take anything away from this, is that the health access plan is definitely going to be really good in a lot of those states where that short-term med is just not really a viable option anymore. I know one place in particular is the state of Texas. It's just really hard to do much as far as short-term med goes down there when the limitation is 4 months, and then you have to go with a different carrier. You don't want to have to put your client through underwriting in the middle of the year. And so that's kind of where this health access plan is going to be a really big benefit, just because most people are having some trouble with the pricing as well as the networks down there in Texas. I do know that is one state where there is a lot of issues down there, and there's a lot of need for some alternatives. So for those that are in Texas, and then a lot of the other states, Minnesota, South Dakota, some of those other states where short-term med just isn't even there. Those are going to be. It's going to be real handy to have some sort of option there that would be outside of the ACA. With that, I'd say let's go ahead and wrap this up. Everyone should have our contact info here at Western, but just in case, if this is something that you're interested in getting set up with, or if you have any questions, please give us a call here at Western Marketing. Our phone number is going to be 800-852-7152. Thanks, everyone.
Thanks, Taylor.